And we're live. Hello, LinkedIn. It is fantastic to be back with you for a new season of Healthcare Thought Leadership. I took the summer off, but I'm ready to kick off a new year and a new session with you here on our show. I'm Marion Spears Carr, and I just am very happy to be with you. And today, our topic is one that I really believe is so on point in timing, is this idea of healthcare leaders need to rebound, be re-energized, and reinvent themselves because there's so much happening in the job market. But my guest today is with a lot of you who've said yes to come to the show. You know her really well. This is Georgia Casciato. She is the regent for ACHE for the Chicago chapter. She's unbelievably well known throughout healthcare on a lot of different fronts. And I'm going to let her introduce herself. But Georgia and I have been friends for a while now. And Georgia, thank you for being on the first episode of the new season. How are you?
I'm doing great. And I'm absolutely thrilled to be here today because, as we've discussed, this is a topic I'm incredibly passionate about.
Yeah, tell us a little bit more about your background, because I think that really provides the context for the discussion. And you and I have actually been talking about this topic for about 6 months now. I think, matter of fact, when we were at Congress, ACHE Congress, and by the way, for those of you who are watching the show who are not familiar with ACHE, it's the American College of Healthcare Executives. It's an organization that promotes and develops not only young leaders in healthcare, but also all of us old people in the business too. It's an amazing organization. But Georgia, tell us a little bit about your background and in the work that you do and the work you have done.
Well, Marion, if I could start out, I know that we're talking to a healthcare audience, and I know we're talking about a very passionate topic, especially to a lot of people, because this is post-pandemic and we don't know what's brewing for future. Yeah. So I feel I would be remiss if I didn't start out by really expressing gratitude and appreciation for frontline healthcare workers, the communities, the scientists, the healthcare leaders that support those individuals who really carried us through the pandemic and who really puts a whole different focus of leadership in a different category. So in full disclaimer I know, Marion, you and I spoke a little bit about the who I am and who I'm not. I have never touched a patient, nor should I. That my domain in the healthcare space, which is, we'll just leave it at 30 plus years, is really on the side of personal development, team development, and leadership development. But my credentials, my earned credentials in that space are in strategy, marketing, sales, strategic partnerships, and entrepreneurship. My industry of passion is healthcare. And again, we all touch it in different ways. It means different things to all of us. And this was a niche for me. When I started down this path, the skill set that I talk about is not that unique in a lot of other industries. But 30 years ago, strategic planning, marketing, and sales being a 4-letter word in healthcare was something that was not understood. But yet that really allowed me a platform to differentiate myself. Half of my career has been employed in leadership roles in health systems, think tanks, high-level consultancies, the other in my own consultancy. And again, I lead key functions in those areas of competencies that I mentioned. I know when you and I met, I mentioned that people typically hire me for one of two reasons: what I know and who I know. Again, I'm a serial networker, hence you and I meeting for spanakopita at a Greek restaurant. I'm a frequent
Exactly.
And if my role is really to facilitate the dialogue in healthcare, regardless of where it is, always in search of a better answer, I feel I have no ego of where that answer comes from, because it can come from many people. And I know, watching the people that signed up for this program, just an amazing group of leaders.
Amazing group. And I do want to give a shout out. If you're watching live, please post in the comments. Let us know where you're watching from. Favor, she's a regular of the show. She's checking in from Atlanta, Georgia, and she's happy to be here. Favor, it's so glad to have you. And she's an excellent professional, healthcare professional, and is someone who's been interacting with the Healthcare Thought Leadership Show for quite some time. One of the things that when you and I started talking about the market, and those of you who don't know me, I run an executive search group. in healthcare and life sciences. I'll also say 30 plus years. I think it was 33 now. I think it's my 33rd year. I've never touched a patient, but by golly, I've been a patient a few times over the years. My orthopedic surgeon back in North Carolina has a half of a house that I think I paid for, but that's another story for another day. But I've worked with healthcare companies all over the country. One of the articles that I was looking at that really shocked me, you and I were talking about how that this need for healthcare leaders to kind of rebound from some of the things that are happening going on. One of the things I read, an article, a research paper that was done around, or a survey, 97% layoffs there are 97% more layoffs in 2023 than there were in 2022. Mm-hmm. That's a significant number. And a very high percentage of those layoffs are at the administrative and the executive level. Mm-hmm. Combine that with the fact that I looked at another study where healthcare executive turnover is extremely high. And there's a lot of challenges in the marketplace. Mm-hmm. I'd love for us to talk about, for you to talk about how you look at it from the perspective of what's something leaders that are caught in this situation need to do to rebound. And by the way, a lot of people are checking in. Dave from Albany, Lily's checking in from Austin, Texas, Ronald in Baltimore, Ann from Peoria, Jennifer's from Chicago suburbs, Carol, Atlanta, Thurston down in Dallas, Sean from Chicago, and my friend Doug Luckett, a gentleman I've known for a very long time, checking in from South Carolina. Keep placing those comments in the comments. Let us know you're there. And also, if you have questions or like to join the conversation, please let us know. But Georgia, talk a little bit about kind of how you see the market, what's happening in the market, and why rebounding, I guess, first is one of the first steps for leaders who maybe getting caught in some of these challenges.
Mm-hmm. Well, I think it's really important to actually what I started with, Marion, is really recognizing those frontline workers. And when I've been in executive roles in healthcare systems. And so when you get to the point where you're making cuts and changes, you're not going to cut the people that are touching the patients. That's our core business of what we do. And it's maintaining that connectivity. Now, again, as health systems rebound from the financial aspects of what they're doing, from the operational aspects, they're going to look at making cost-cutting efficiencies, downsizing, right-sizing, whatever the right verbiage is in those areas. And I think the real piece for healthcare leaders is, and this is, while we're focused on healthcare, this is a life conversation.
Yeah, it is.
What we're talking about applies to every industry. But I think it's really important to understand what your value is to the organization that you are with. And here's the most important one. You are still who you are with or without your health system, with or without the experiences that you bring. And I think really important piece, and sometimes it might sound a little trite or hokey, corny, whatever the word is, but is even to make a list of who you are and what you bring to the equation, because that's going to pivot you for a different role, either in your current organization or in finding new opportunities. I've also spent some time in placing interim executive advisory and some executive search as well. And the one thing that I find really interesting is that people tend to forget who they are, even when they're crafting a resume. You and I were talking about this.
Oh, yeah, absolutely.
Yeah.
See it all the time.
And they delete the key ingredients that I know. I've had situations where I was placing executives in roles in a past life, and I knew that they deleted, like, the gold that I was positioning them with. And I go, what the heck is this? And they would be like, well, that was like 15 years ago. That was 10 years ago. And I go, was that knowledge surgically removed?
Because, great point. Yeah,
yes,
exactly.
Because I happen to know that's why they're interested in you. And I just happen to know that part of your background, but somebody else won't. So be very holistic. Take an aerial view. There's a wonderful Dr. Seuss book of all the places you go. And when you open it, it's got a little Sneetch-like character with all these different paths. It's like, where can you go with what you know? And don't limit it just to where you've been.
I love that. And a couple other people checking in. Dr. Owens Collins checking in from Maryland. Camellia is checking in from Cincinnati. And Toyetta Dixon, someone I've known for years and years and years, and is up in Chicago. Glad to have you and love to have you. I see Thurston checking in from Dallas. I love that idea about understanding where you came from. I do a lot of work in the world of coaching people to see that value. And one thing you and I just talked about not too long ago is this idea around all these great leaders are put in these situations, and some of them solve problems better than others. They're very good at solving problems. And that comes from having an awareness of the skill sets that they bring to the table. And as you were talking about reviewing that history, if you will, like where you've been and what you've done and what impact you've made. One of the things I'd really be interested in hearing you talk about, Georgia, and you and I've talked about this, is how can they open their mind up around taking those successes, those skill sets that they own, and moving them into a different context? Because I think sometimes we just get so pigeonholed. Leaders sometimes get so stuck. I've been in this track my whole career. This is the only thing I can do. And that's really not the case. What are your thoughts on that?
Well, when I interview people, I really interview them from two perspectives. What have you done? What can you do? And that second part of that, what can you do, is really more in response to what you're describing. But this is a huge place to connect with local organizations. Again, I believe it's really important part of personal development to anchor to an association home. Mine happens to be American College of Healthcare Executives, 15 years in that. Again, I'm a vice president of the local Chicago Health Executive Forum chapter. But there's HIMSS, there's HFMA, there's American Hospital Association, there's American Medical Association. It's like find your tribe and find your people to think differently, but also step outside that. Go to a networking event that is totally outside your place. Maybe it's a place in health technologies, maybe it's a place with innovators. And the most impactful question for connectivity that I have found when you talk with people, and this may tie into something else we talk about, that when you go in and you're meeting people, I know it can be really uncomfortable because you're out of your space. You're not with your people when you go in. You're looking for new people. Yeah. Ask people why they attended this event, why they connected with this organization, because that's a very engaging conversation. Too many people walk into events and search name badges. Like, is it worth it for me to spend my time with you? Terrible way to do it. Terrible.
Bad way.
Bad karma.
Way. Yeah,
bad karma. Don't do that.
Absolutely.
Ask people why they chose to come. What have they gotten out of it? What are other groups that they have connected with? But you definitely need to take a much broader approach and be comfortable in your own skin going in. You will acquire this over time.
Yeah. I think I love the fact that you brought up all these different organizations. For example, I spoke yesterday. I was at the Virginia chapters of HFMA, their fall conference. And one of the questions that I love that question about why did you come to this meeting? What do you get out of it? Why are you part of this organization? I love that is a great opener. And I have not ever been around many. I'm a member of HFMA, but I've not been to the Virginia chapter. And I asked a very similar question. It was, what makes this chapter special, right? Just like what you're talking about. I think that's a great way to get engaged. And if you remember, Georgia, while we were at Congress, I actually drug you to a meeting with with the association called the Association of Corporate Growth, and I'm a member of the chapter in Chicago, even though I'm based in Atlanta. And I saw you work the room just like that. I saw you with that technique. So that's absolutely on point.
Marianne, can I say something?
Jump in. Yeah, absolutely.
Okay. For me, that's not a technique. That's a way of life. Again, I have heard this said before, and I think it's really an important way, is that when you go to one of these events, treat it like it's your own party. And my reason in saying that, because I know you and I both did this, it's like when we would meet somebody, we would introduce them to somebody else.
Exactly.
And again, it creates an energy for the room. And even if I don't know the answers, and that allows me, if it's a room that I do know, oh, wow, you're talking about financial turnaround of this kind using IT. Oh, are you aware that so-and-so's over here? Let me connect the two of you. It's a cool place to live. I love living in that space.
Yeah, and it's one way. It's and to the second point we were talking about. It was a rebounding is okay. Now I've been through what I've been through. Now I got to refocus and get back into the job market, or back into may even have to dig deeper in the role that we're currently in. We may have to really get re-energized into that role. I want to shout out Thurston was taking your point about going further back in your career. He says, I just applied for radiology practice administrator and haven't worked in radiology for over 20 years, but he most likely owns a whole lot of skills and can bring it to that experience that might even make him even a better administrator, because he has a much I love the idea of holistic. Favor says, I definitely agree with taking a holistic and aerial view when applying for a role or even working in your current role. We need to show up as our full selves. And I think that's what you're talking about. In Georgia, every time I've been around you, you show up as your full self. I mean, you're all in. What are some other ways that people can get really kind of re-energize their career or re-energize in the work that they're doing that you've seen?
Well, I'm going to just comment to Thurston's comment for a minute.
Oh yeah, sure.
Okay, you talked about being 20 years, 20 years since you've been in that space. Highlight what you've done of immense value in the last 20 years that it's an added dimension to that piece, and here's one thing I want to say too, that's really, I keep saying everything's important, but this is really an important conversation. It's all important.
Absolutely. It's all important.
Yeah. Everybody's not going to get you. I mean, even when you and I were talking, Marion, I mean, people can look over my background and say, oh my gosh, I see all of these wonderful connections. I see the path. I see the trajectory. I see your value. I get you. And other people can look at my background and say, lady, I'm sorry, I just don't get you. I don't care about that second group. Nobody gets everybody. And sometimes even like with a job, when somebody is looking for work, again, they tend to focus on, like a finite number of prospects. Maybe there's 10 prospects. They send information out. Maybe they hear back from 5. Maybe they get communication with 3, maybe 1 or 2 job offers. The problem that people have is they lament on the 7 or 8 that they didn't get traction with, rather than going on to a new group of 10. It's a big landscape out there. It's a huge landscape out there. So I would say most important thing is, and you may have to put a sign in your mirror in the morning, do not forget who you are. And your value is something that's been culminated over a career. And some people are going to get it and some aren't. You need to find your people.
I think absolutely. That's of all the stuff you've already shared in the first, 15 minutes of our discussion, that right there is so profound. And not everybody's going to like you. I remember when I first started doing speaking and training, I would get the reviews and there'd be like 98% of the group said you were gave you a 5. And then there'd be like one person that gave me a 2 or a 3. I would obsess over, why did that one person not like me? It's the same concept. And then when in fact, that's just neither here nor there. And I think maybe the numbers are reversed. The percentages might be different in terms of job search, in terms of putting yourself out there. But one of the things, you're right, all you need is one person to say yes, and you're back in the game. Talk a little bit about, from a perspective of re-energizing, about looking at the industry from a lens of not just focus on being in the hospital space or being in some other areas. What are areas that you're seeing in healthcare on much, because you've worked in much broader scale sets of companies where the skill sets and backgrounds and qualities and strengths that people have developed as hospital executives can translate now? What are some of the ideas around that? How can they re-energize in that space?
Sure. Well, let me just call out to healthcare executives right now, people who might have left C-level roles or the roles left them. Okay. And just say too that I do have, on my website, georgiacachado.com, a host of articles. And I had actually done 2 articles on that topic that are under the publications. And what I would really call out under a C leader is, if you are wanting to be positioned for interim work, you have to recognize that you are not going in as the CEO. If you're leaving as the CEO, you're not coming in as the CEO. So you really have to think very differently about how you package and position your skill set in coming in. While, and I'm going to put this forth as a business opportunity for many, but while I may have started very much in the healthcare space and, senior VP of strategy, marketing, sales for health systems and different kinds of organizations, where I have really found a lot more traction in recent years, and again, could be a perfect place for healthcare executives, is helping organizations who want to get into healthcare and don't know how. That, from that perspective, and I know you kind of like the little tagline, which I am going to be using, is I speak fluent healthcare, but going back to my original disclaimer, I've never touched a patient, so I speak fluent business healthcare. So helping organizations understand key markets. I mean, there are a lot of trends that we're aware of. We're aware of the role of technology, the role of AI, the role of everything moving outpatient, people living longer. There's so many different places where we can anchor, a couple of organizations that I'm working with right now are very much on post-acute care. And it's really helping them understand where they are in the space. Innovative programs like home-based primary care, house calls. I'm working with an organization right now, Home Centered Care Institute. Their physician, who is actually from Northwestern, has done 37,000 house calls. So that's telling you that's a new market. What's the transition from hospital to skilled nursing facility? How do you orchestrate that? I mean, there are so many interesting places where if healthcare leaders think about what their skill set, what did you do in the hospital? What did you do in another organization? Forget the day-to-day. Take the aerial view value of what you accomplished, and it will open up opportunities. But more importantly, the whole second piece is how do you position yourself for those? It's never a conversation of I can do. If you find someone that you think is open to the conversation, it's a whole interactive questions with them. Help me understand your marketplace. What are you trying to accomplish in working towards your goals in reducing admissions? How have you approached that in the past? Is there perhaps an insider perspective that might be helpful that I could offer? Notice nothing I'm saying is I'm the greatest in the world and all this, because quite frankly, your story doesn't make sense and is of no value if it doesn't connect to your audience. So ask enough questions so you can understand before you try to make that connection for your own advancement.
Yeah, absolutely. In the chat, there was a comment that said that the show may have looped back to the beginning. And Jennifer, thanks for letting Doug know that if you just refresh it, that's back. There is a question. I knew this conversation was going to go fast. There's a question I'd like to put on the screen because I think it speaks to understanding your value in the context when you're working and when you're not working and what you bring to the table. And one of the questions is how do you get recruiters to see your true value when you have had breaks in your career? And because of some of the challenges that people have had gaps. And I'd love for your input. I can share mine as well, but I'd love your input on that, Georgia, because I think it speaks to understanding your value. Thank you for that question.
First of all, Marie, only one of your avenues is recruiters. Do not put it all with the recruiter.
Amen.
It's important for you, if you've been in your marketplace for a long time, look at the organizations that you really admire and try to link in with some of those executives and people who might understand your message. Again, a huge plug for associations, not just the ones that I'm involved with. But when I started my career, first of all, I moved from Decatur, Illinois. I was either half the town was Greek and the other half I was related to. So it was a very easy business model.
Gotcha.
When I went to my first, I came to Chicago to work for the Adventist Health System, Hinsdale Hospital. I could not get an appointment to save my life. I was in a sales role. I'm going to be back in Decatur next month. And so I went to a networking industry event. And as I looked down on the table to find my name badges, I see all the name badges of these people who I've been calling who've been blowing me off.
Wow.
So my point is, wow, maybe there's something to this association connectivity to one, legitimize myself in the space I want to be, two, make the connections that I need in my own community, and three, establish a dialogue. If I can make a connection with someone at that event that I seem like I'm somebody you'd want to spend a half an hour with outside of this. So also, when you look at events that industries and associations are putting on in the area, see not just what the topics are, but who's speaking. There is no better time, and Marion, you can probably attest to this as well, for someone to connect with you than when you've come off the stage and you're wrestling with yourself, whether you were brilliant or you're going to be back in Decatur next month.
So or you're going to be back in Decatur. In my case, back in the mountains of Georgia.
Right.
Exactly.
So that's a great time to talk to somebody, not to sell them on you, but to just say, great conversation, enjoyed your contribution. I'd love to stay connected with you or one member of your team. Here's a little bit about my background, and then a quick exchange of a business card. Link in with them right afterwards. But that's it. You got to expand. If you're waiting for recruiters, it'll be death by recruiters or death by HR. Yeah, you've got to have different ways.
That's a massive investment. And even though I'm in the executive search space and we're very project driven, we're driven by what our clients asking us to find, et cetera. One of the things I always tell people is, like, most likely the person that's going to help you or the people that are going to help you find your next opportunity is already in your network. Mm-hmm. They're already in your circle, to go back to the first part of this conversation. Mm-hmm. And that's why we always need to continue to grow our network and bring value to that network, be it getting involved with ACHE or different chapters. Mm-hmm. And this, by the way, for those of you who are on the show, this isn't an ACHE sponsored event. We just believe in the ability to connect with people in that way. As a matter of fact, in Georgia's point, just to, in all transparency, I know I do really well when I speak to a group. If I come off the stage and I'm not depressed, I didn't do a very good job. But if I'm depressed, that means I left it all out there. So I probably did a pretty decent job. That is a great time for somebody to walk up to me and introduce themselves to me, because I'm struggling with, am I depressed or am I not depressed? Did I do a good job? Did I forget something? For those of you who are watching the show, this is called Healthcare Thought Leadership. It's used to be weekly show, and now we're going to do it bi-weekly, every 2 weeks, the first and third Fridays of the month typically. But I'm going to interview a lot of different people, bring a lot of different people on the show. Georgia, we only have a couple more minutes. So we've talked about the need to rebound. We've talked about how to re-energize by getting involved, studying the industries, and connecting with people. The last part of this circle is about reinventing ourselves. Sometimes we have to bring something new. We have to learn something new, or we have to find a new area. Mm-hmm. How would you recommend in the last couple of minutes we go through that process?
Mm-hmm. First of all, your life is not just about your work. There are very few people on their deathbed who say, darn it, I wish they would have spent more time at the office.
Yeah, exactly.
So round yourself out in other ways. Like, I know for me, a huge part of my creativity is piano. And I know when I carve out time to do that, I don't think about anything else. It refreshes me. It opens me up to other creativity. And find other places where you can contribute. One of the things that you said a minute ago, Marion, that I think transfers over here is, when you're looking to establish your own value, recognize that it's really important to help people around you, because not because there's any big motive or any big immediate payoff, but because it's the right thing to do. And I also look for people who are really willing to put themselves out there. When somebody will contact me, and again, I'm one person. Yes, I'm the regent. Yes, I do this. Yes, I do that. But I'll say, I'm one person to look at your background. How can you join any organization, join a committee, and get 20 people on your committee looking at your resume? Exactly. And what's your give back? So many times people show up, and that's a question even I instructed my daughter to say when she was going to her first networking event. I said, Myra, ask people, when you're talking to them, say, I'm new in my career, I'm just figuring it out. But as I'm out talking to a lot of people, if I were to come across somebody who is particularly important in what you're trying to do, who would that be?
Brilliant. Yeah, I think that's that power of reciprocity. Cialdini talks about when we give, people are more likely to give back, and not in a manipulative way, but if we share and we bring value to the conversation, absolutely. And by the way, we've got a whole bunch of other people join us. Lindsay is checking in from Alpharetta, Georgia, another amazing healthcare professional I've known for quite some time. Last question, because we're about to run out of time. I try to keep it to 30 minutes, and I always knew we were going to run over. Georgia, how can people connect with you?
Well, you can connect with me through my LinkedIn.
Okay.
That's probably the best way. And let me know who you are, what you're about, what you're looking to do. I do a lot of groups, a lot of student groups, again, because that's part of my regent role.
Yeah.
And I always ask people, like, okay, why are you doing this? Why are you here? You know, and so from that perspective, let's just open up some interesting dialogue. A lot of the ideas, concepts that we've talked about, I look to rebrand in my own next reinvention, which will be, yeah, I'll continue my consultancy, but an Energizing Leaders LLC that I'll be launching first of the year, that will be very much about these kinds of concepts and interactive ways for us to connect. So please don't be a stranger. You're all invited to my house for a Greek Thanksgiving, 3:00. We'll sit down.
That's awesome.
Let me know what you plan on bringing. You can text it to me, but
there you go.
It's just about the dialogue, Marion, and I'm so grateful that you chose to bring me on board today and have this conversation.
Oh, it's Georgia. It was a no-brainer to bring you on the show and to start the new season with you. And I appreciate my friendship and the work that we hope to do together. Absolutely fantastic. So for those of you who are watching the show, if you're not connected with Georgia, find her on LinkedIn. I'll actually, in the comments in a little bit, I'll put her LinkedIn, but you can find her by just using the search block. If you're not connected with me, if you happen to not be connected with me, please send me a connect request. You'll see follow, but click on the down arrow and send me a connect request. Let us know. Let me know that you watch the show. Please, if you enjoyed what you saw, please share it with your network as well. This is recorded, so it's evergreen, and you can have other people watch it if they didn't see it live. This is the Healthcare Thought Leadership with Marion Spears Carr, and I'm just so glad you're here, Georgia. Thank you so much, and have a great Friday.
Thank you, and thank you, Marion, and thanks to all those folks that checked in with us today.
Absolutely. Have a great day, everyone.